Joining us now, Dr. Bayo Curry-Winchell. She is a physician and health equity advocate. Dr. BCW, always great to have you out. So tell us a little bit about some of these other social risk factors that impact our health and who is the most affected by them.
We are seeing several. The first one is really having access to high quality care. Also food deserts, as you mentioned, are a huge issue. Also financial. You know, when we think of inflation, what's happening right now, that is actually impacting care. The other thing is health literacy and just barriers to transportation to get to your doctor.
I mean, those are a lot of things to think through. When you look at that list, which one is sort of the most beyond our control?
It is the financial piece. You know, my patients are struggling. They're like, should I pay my rent or pay for my medication? And it's a really hard thing to do. And, you know, often it's the light bill that is really winning versus your health.
Yeah, absolutely. People do put their health on the back burner.
Yes.
What are some of the resources that people can turn to, the things that people can improve or control that will have a better outcome for their health?
So literacy. I always say the more you know, the more you can do about it. And so using that to invest in public resources, finding out what is available, what community hospitals and organizations are free or possibly have a sliding scale. That allows you to make a small step. Even when things feel kind of out of control, that's something you can do for your health.
How do you actually ask about that?
So you're going to check online. So you're going to look online, but also ask your friends, because that's a great resource. Often people are utilizing resources that they have no idea that their neighbor is using. So if we can all come together and just use that dialogue to help our health, well done. That's how we're going to make progress.
I love that sort of communal element of just being transparent and also asking for what you need. And I think sometimes that can be like sort of the steepest hill to climb too. It's daunting combing through all this medical information and really making yourself literate. Is there anything that we're missing? Are there other things that we could do to sort of make these barriers a little less steep?
There are, you know, really thinking about how we can invest in our family, letting our family know these are the health conditions that I'm dealing with. That is a way to create a pipeline so you know more about your health, which helps your family member, which overall decreases your risk for developing disease, because once you know about it, you can invest in those preventative care.
What about the medical community? What is the establishment, so to speak, doing to reach out to these communities so the onus isn't just on the healthcare consumer?
We are really investing in diversifying our workforce, because studies have shown the more you look like the community you serve, the better your health outcomes are. Also looking at how can we promote health and education that is diverse, that really sings and helps people of that community.
You know, and I feel like that also empowers them to know that there are resources, right, that are available. What are the number one questions we should be asking our doctors when we do get that time with them?
The first thing is, tell me more about what you are concerned about with my health. Tell me why you're ordering this lab test. What are you expecting? Because then when you have that information, you're able to say, okay, maybe you missed this part. Or tell me, I didn't realize this, you know, specific situation. So that's where you can start when you see your doctor.
That's great.
Dr. Bayo Curry-Winchell, it is always a pleasure when you come to our studio. Thank you so much for your expertise and your time.
Great to see you.